Margaret from Silver Springs asked, will Congress consider suspending the mandatory retirement distributions for 2008? Such a move would make life better for millions of seniors. And let me tell you what the issue is here, because Margaret has a very good point. The problem is that because of the downturn in the economy, people are looking at their retirement funds and saying, gee, I've lost so much money. But the federal government requires me at 70 and a half, at age 70 and a half, to take a minimum distribution from my retirement fund. Well, I don't have as much as I had before. And I'd rather hold on to some of this money because I don't know how long I'm going to live. And I want to make sure I don't run out of money. I certainly hope that we will pass emergency legislation. Senator Baucus has authored it. I'm a co-sponsor of it. That will allow you to forego the minimum distribution rules and be able to keep more money in your retirement accounts so that you have it for later in life to make sure you don't run out of your retirement funds. It's a very good point. We hope to take action early in 2009 to protect your type of circumstance. Janet from Montgomery County asked, as our population ages, what do you think should be done to better fund the Social Security Trust Fund? Again, this is an excellent question. The Social Security Trust Fund is in excellent condition. It has funds to be able to pay for the foreseeable future. I don't think there's any risk that people who are receiving their Social Security checks will continue to receive those checks, and those who are retiring will get their Social Security checks. We, though, try to deal with 75-year solvency. Now, 75-year solvency is a long time. And there are relatively minor changes that could be made in the Social Security system in order to protect its long-term solvency. President-elect Obama has made some suggestions that perhaps we look at the wage level in which you pay your Social Security funds and the employer matches it as one way. I think there are ways that Congress can work with this administration to ensure the long-term solvency of Social Security. Let me say one other thing, and that is, if we didn't use the surplus, the cash surplus in Social Security to mask the true size of government spending, I think it also would help preserve the Social Security Trust Fund. We really need to take it totally off budget, so it can't be used to mask government spending and government debt. The trust funds should be used only for Social Security. Monty from Maryland wants to know if I support a one-payer health care system. What kind of impact would such a plan have on individuals like him who have private health insurance? Well, let me assure you, Monty, I support what Senator Obama talked about during his campaign. It's not a single-payer system where all the payments go through the federal government and everybody's in the same health care plan. It's where we have competition and diversity, where you can keep your employer-provided health insurance, but you have options to get a more comprehensive coverage and a community-rated plan if you don't have a good employer-provided plan or you're uninsured today. The bottom line is we've got to reform our health care system. We need to bring down the cost of health care in the United States. We have to make sure that every person in this country has health insurance. It's wrong for those who have health insurance to pay for those who don't have health insurance. It's wrong for the taxpayers to pay for those who should be responsible for their own health care needs. We need a more cost-effective system. We've got to bring down the cost of prescription medicines. We need a much stronger emphasis on preventive health care that can save money. We need to use information technology more efficiently to bring down the administrative costs of health care in America. All that needs to be done as part of health care reform. And I can tell you this, I'm going to be working very closely with President Obama and my congressional colleagues on both sides of the aisle to see that we can enact comprehensive health care reform so we bring down the cost of health care in America, but make sure that everyone has access to affordable, quality health care.